Solidarity forever.
The Kenya Medical Practitioners, Pharmacists and Dentists Union has threatened to reinstate a 60-day countrywide strike it suspended in January 6, 2023, should the government fail to put in place measures to recruit additional medical practitioners annually.
Solidarity forever.
The union initially suspended the strike after holding successful talks with the government, with the state then pledging to address some of the doctors' concern, including delayed salary payments, insurance covers, and the timely posting of interns and doctors in health facilities across the country, among others. KMPDU Secretary General Dr. Davji Bhimji Atellah stated that Kenya does not meet the patient-to-doctor ratio of 1 to 1,000 as recommended by the World Health Organization, noting that a single doctor serves 17,000 patients.
But then when you look at it, even our demand that we wrote to the government in the month of December, some of these issues we outlined clearly. The fact of unemployment, the fact of salary delays. So you realize that the employer, if he delays to pay a healthcare worker in the county who has no any other source of getting salaries for 3 months or 4 months, then you drive them to die. You drive them to the action that they will take against themselves and to their desperations. So we have been calling out that and asking governments to actually commit to paying salaries on time. There's aspect of unemployment. When doctors are not employed, those few who are in the hospital struggle. They are at a point that they work for 100 hours a week instead of the 40 days that has been signed in the CBA.
The SG added that the county governments have shortchanged local doctors in recent years by training them but not renewing their employment contracts or offering them compensation packages comparable to work they do. Dr. Atellah also noted that some of the resolutions captured in the 2017-2021 collective bargaining agreement have yet to be fulfilled by the state, despite the union calling off its planned industrial action early this year in good faith.
We have seen some counties going into punitive actions by employing healthcare workers onto contract terms. The Public Service Commission's guideline on employment is very clear, that you can only be employed on contract if the job you're going to do is for a fixed period. If the job you're doing is continuous, like for doctors, there's no need to put them into punitive actions of employing on contract, because that even impedes the career progression. So some of the counties that have been doing that, we've gone on to them and asked them to stop that. And you've known that even some governors who are really propagating these were voted out by the healthcare workers themselves in some counties. So it's very clear that the terms of engagement should be the terms that have been approved by the PSC.
While mourning the death of Dr. Frederick Mwoki Wambua, who died by suicide on Friday last week, the KMPDU boss added that many young medical practitioners are taking their own lives after spending 7 years in medical school and still failing to acquire decent jobs in the industry. He said that 7 doctors have so far died in the last 2 years due to depression.
In the last 2 years, we have a report of about 7 doctors that have been recorded to have passed on out of the depression and out of the difficult working environment. One case we had from Kenyatta National Hospital who died in the parking. We've had cases from Nakuru County, though for one of the doctors who died that county. We have had also cases in different parts of the country, and we had this particular case. So we have also a number of doctors also who, I think about 2 of them also from Laikipia during that particular frustration that was brought by that government. We have a number of doctors, just like other healthcare workers, who have gone into depression and end up using substances like alcohol just to run away from the desperate situations that they are in.
My colleagues from 2-3 years ago, 4-5 years ago, have not managed to secure employment, and even as we stay out here with no places of work, the hospitals are very, very understaffed. Even while we were working there, you can see that the hospital completely depends on the interns. When interns are not posted, then nothing really happens. Why? Because these general hospitals have no doctors. There's completely no doctors. The hospitals have a capacity of up to 60 bed capacity, while out here we are suffering. You go to a public hospital, you cannot be saved. Small things like what happened to our former cabinet secretary recently are things that can be dealt with very easily.
I want to assure you that as long as you're living, you're going to need the healthcare. The doctors are very angry. KMPDU has been making noise every day, every week. We call you guys here, raising the same issues. But now it's time to do the other alternative action. Because we can't have a country where every month we have to go to the streets to get our salaries. I know counties where people have been paying for 2 months, where you have loan deductions on your pay slip and they don't remit to the banks. In CRB, doctors are like the highest number of civil servants. You don't have a medical cover. In Nairobi County, we almost shut down because NHIF locked them out in non-payment of the dues. It's a shame. You see governors launching buildings all over the place, but nothing about the healthcare worker. We are angry.
KMPDU says that the government has only hired 500 doctors in all the 47 counties in the last 5 years. They say that the government will not be able to achieve the universal health coverage under these circumstances. The Doctors' Union now want the government to prioritize hiring of doctors just like teachers and police officers. Samson Jura for Ebro News.